Well, welcome viewers, Dr. JWAU. The Irreversible Body Gamble, Episode 7, The Body That Cannot Be Rebuilt. Modern medicine can achieve extraordinary things. A damaged heart can receive a new valve. A shattered face can be painstakingly reconstructed. Artificial joints restore movement. Skin grafts save burnt victims, and prosthetic limbs allow people to walk, work, and compete at the highest levels. These achievements deserve admiration, but they also reveal an important distinction. There is a profound difference between reconstruction and restoration. Reconstruction seeks to create a new function outcome after tissue has been lost, altered, or damaged. Restoration seeks to return the body to its original biological condition. And these two are not identical. A reconstructed structure may restore appearance, relieve symptoms, or improve function, or all of the above. It may represent remarkable surgical craftsmanship, yet it does not reverse the developmental history of the body or recreate the original biological tissues exactly as they once existed. And this distinction extends well beyond any single area of medicine. Throughout surgery, clinicians recognize that some biological changes become permanent. Scar tissue forms differently from the tissue it replaces. Artificial implants serve valuable purposes but remain engineered substitutes rather than regenerated organs. Even the most advanced reconstructive procedures operate within biological limits. And this is not a failure of medicine. This is a recognition of biology. The human body possesses an extraordinary capacity to heal, but it does not possess an unlimited capacity to rewind its own developmental history. Excuse me, viewers. That reality introduces a deeper question. When an intervention permanently changes healthy anatomy, what does it mean to say the body can later be put back? Can it truly return? Or can it only move forward into a different biological reality? Understanding that distinction does not diminish medical progress. Instead, it helps define its boundaries. Medicine can often repair. Medicine can frequently reconstruct. Medicine can sometimes replace. But restoration has limits that no surgical innovation can completely overcome. Those limits are not obstacles to progress. Those limits are reminders that every permanent intervention carries a permanence that even the greatest surgeon cannot fully erase. Because before informed consent can be complete, the limits of reconstruction must first be honestly understood.